and welcome to Medical Dialogues. I'm Dr. Bhumika. Let's look at today's top medical news. Association between combination of Mediterranean and DASH diets and cognitive impairment AAN study. People whose diet more closely resembles the MIND diet may have a lower risk of cognitive impairment according to a study published in the Journal of the American Academy of Neurology. Results were similar for black and white participants. These results do not prove that the MIND diet prevents cognitive impairment. They only show an association. The MIND diet is a combination of the Mediterranean and DASH diets. With the number of people with dementia increasing with the aging population, it's critical to find changes that we can make to delay or slow down the development of cognitive problems, said study author Russell P. Sawyer, MD of the University of Cincinnati in Ohio and member of the American Academy of Neurology. We were especially interested to see whether diet affects the risk of cognitive impairment in both black and white study participants. The study involved 14,145 people with an average age of 64. Of participants, 70% were white and 30% were black. They were followed for an average of 10 years. Participants filled out a questionnaire on their diet over the past year. Researchers looked at how closely the foods people were eating matched the MIND diet. 1 point was given for each of the following: 3 or more daily servings of whole grains, 6 or more weekly servings of green leafy vegetables, 1 or more daily servings of other vegetables, 2 or more weekly servings of berries, 1 or more weekly servings of fish, 2 or more weekly servings of poultry, 3 weekly servings of beans, 5 daily servings of nuts, 4 or fewer weekly servings of red meat, 1 or fewer weekly servings of fast or fried foods, 1 or more weekly servings of olive oil, and 1 or fewer tablespoons of butter or margarine daily, 5 or fewer weekly servings of pastries and sweets, and 1 glass per day of wine. The total points possible was 12. Calorie labels on alcohol bottles can change the habit of heavy drinkers survey. Just over half of heavier drinkers in England say they would make changes to their drinking if calorie labels for alcohol were introduced, according to a new study by University College of London researchers. The findings suggested calorie labels could help some drinkers maintain a healthier weight. The study, published in the British Medical Journal, Open, looked at survey responses from 4683 adults in England to assess the impact that alcohol calorie labeling might have on people's attitude and drinking behavior. The researchers found that 54% of heavier drinkers said they would make changes to their drinking if calorie labels were introduced. This compared to 44% of lighter drinkers. Asked about specific behavior changes, more than a quarter of heavier drinkers said they would choose lower calorie drinks, while 1 in 6 said they would drink alcohol less often and consume fewer drinks. The researchers also assessed people's knowledge of the calorie contents of alcoholic drinks, finding that hazardous drinkers were more likely than low-risk drinkers or non-drinkers to accurately estimate the number of calories in beer, wine, cider and spirits. Critical associations of metal exposure from environmental pollution linked to cardiovascular health study. Metal exposure from environmental pollution is associated with increased calcium buildup in the coronary arteries at a level comparable to traditional risk factors like smoking and diabetes, according to a study published in Journal of American College of Cardiology. The findings support that metal in the body are associated with the progression of plaque buildup in the arteries and potentially provide a new strategy for managing and preventing atherosclerosis. Our findings highlight the importance of considering metal exposure as a significant risk factor for atherosclerosis and cardiovascular diseases, said Kathleen E. McGraw, PhD, a postdoctoral research scientist at Columbia University, Mailman School of Public Health and lead author of the study. This could lead to new prevention and treatment strategies that target metal exposure. This groundbreaking study underscores the critical associations of metal exposure from environmental pollution to cardiovascular health, said Harlan M. Krumzol, the Harold H. Lines Junior Professor at Yale and Editor-in-Chief of Journal of the American College of Cardiology. It challenges us to broaden our approach to cardiovascular disease prevention beyond traditional risk factors and to advocate for stronger environmental regulations. And it underscores the need for continued research in this critical area. Researchers used data from the multi-ethnic study of atherosclerosis prospective cohort tracking 6418 men and women aged 45 to 84 from diverse racial backgrounds free from clinical cardiovascular disease to measure urinary metal levels at the beginning of the study in 2000 to 2002. They examined non-essential and essential metals, both common in US populations and associated with cardiovascular disease. Results provided evidence that metal exposure may be associated with atherosclerosis over 10 years by increasing coronary calcification. Fussy eating largely a genetic trait. Study. Fussy eating is mainly influenced by genes and is a stable trait lasting from toddlerhood to early adolescence. Finds a new study led by researchers from University College London, King's George London and the University of Leeds. The study, published in the Journal of Child Psychology, Psychiatry and funded by the UK mental health charity Mental Health Research, compared survey results of parents with identical or non-identical twins in England and Wales from the ages of 16 months to 13 years. The research team found that average levels of food fussiness were relatively stable during this period, peaking somewhat around the age of 7 and declining slightly after that. They concluded that genetic difference in the population accounted for 60% of the variation in food fussiness at 16 months, rising to 74% and over between the ages of 3 and 13. Environmental factors shared between twins, such as the type of food that are eaten at home, were found to be significant only in toddlerhood, while environmental factors unique to each twin, such as individual personal experiences, became more influential in later years. Lead author Dr. Zainab Nas said, "Food fussiness is common among children and can be a major source of anxiety for parents and caregivers, who often blame themselves for this behavior or are blamed by others. We hope our finding that fussy eating is largely innate may help to alleviate parental blame. This behavior is not a result of parenting. Our study also shows that fussy eating is not necessarily just a phase, but may follow a persistent trajectory." Senior author Professor Claire Llewellyn said, "While genetic factors are the predominant influence for food fussiness, environment also plays a supporting role. Shared environmental factors such as sitting down together as a family to eat meals may only be significant in toddlerhood. This suggests that interventions to help children eat a wider range of foods, such as repeatedly exposing children to the same food regularly and offering a variety of fruits and vegetables, may be most effective in the very early years." Thank you for watching Medical Dialogues. Stay tuned for more such updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.